What non-invasive options rule out other CFS conditions? Imagine trying to solve a mystery where many clues look alike. When doctors suspect chronic fatigue syndrome, they need to make sure it's not something else causing the fatigue. Since there is no single test for chronic fatigue syndrome, doctors use a variety of simple, non-invasive methods to rule out other illnesses first. The first step is a thorough medical history and physical exam. The doctor asks about when symptoms started, how severe they are, and what other symptoms are present. During the physical exam, they look for signs that might point to other conditions like thyroid problems, infections, or autoimmune diseases. For example, they might check your neck for a swollen thyroid or look for skin rashes. Blood tests are key tools in this process. A complete blood count checks for anemia or infections that could cause tiredness. A comprehensive metabolic panel looks at how your liver and kidneys are functioning and checks electrolyte levels. Thyroid function tests help identify if your thyroid is overactive or underactive, both of which can cause fatigue. Inflammatory markers like erythrocyte sedimentation rate or C-reactive protein can reveal underlying inflammation or autoimmune issues. Blood glucose and hemoglobin A1 degrees Celsius tests help rule out diabetes as a cause of fatigue. Depending on your symptoms, doctors might also test for infections like Epstein-Barr virus or Lyme disease, or assess adrenal function to exclude Addison's disease. Sleep studies, called polysomnography, are useful if sleep problems are suspected. They can detect sleep disorders such as sleep apnea or restless leg syndrome, which often cause daytime tiredness. Brain imaging tests like magnetic resonance imaging or computed tomography scans may be ordered if neurological symptoms suggest conditions like multiple sclerosis or structural brain issues. Exercise testing, such as a VO2max test, can help evaluate how your body responds to physical activity. This is especially helpful because post-exertional malaise, a worsening of symptoms after activity, is common in chronic fatigue syndrome. It also helps rule out heart or lung problems that might cause fatigue. A psychiatric evaluation is often part of the process too. It helps identify depression, anxiety, or other mental health conditions that can lead to fatigue and concentration problems. Since many illnesses share symptoms with chronic fatigue syndrome, this step ensures a comprehensive approach. All these tests are non-invasive. They usually involve blood draws, imaging scans, or physiological measurements. The goal is to exclude other treatable or serious conditions before confirming a diagnosis of chronic fatigue syndrome. This careful process is supported by medical guidelines from health authorities worldwide, emphasizing the importance of ruling out other causes first. If you think you might have chronic fatigue syndrome, it's important to see healthcare professionals experienced in fatigue disorders. They will take a detailed history, perform a physical exam, and order appropriate tests to ensure that no other condition is causing your symptoms. Only after these steps are completed and other illnesses are ruled out can a diagnosis of chronic fatigue syndrome be confidently made. Remember, each person's experience is unique, so personalized medical advice is always essential.